Hi, and welcome back to T.L.C. Cares. I'm Jolene Cicchese, and I'm a registered nurse with T.L.C. Private Home Care, located in Buzzards Bay, Hingham, and Chatham. And today I'm here with my sister, who's also a registered nurse, works with me directly at T.L.C. Private Home Care. And we are two sisters talking about urinary tract infections today. What they are, how to tell if you have one, and then what to do about it. So, Cyndi, welcome. Thanks for coming with me.
Absolutely. I love working at TLC. I feel very honored to take care of our patients on the Cape, especially our elderly who need a lot of help.
And a lot of them have
urinary tract infections, right? And there are some elderly people that are very frail, and there are some elderly people that are super strong. Urinary tract infections affect both.
Right. Young people as well.
Yeah. But today we're just talking about our seniors.
What are some diseases that would make you more prone to having a UTI?
Well, a risk factor is being a female because of our different anatomy from a male. And another risk factor could be that you have hit menopause and that your body changes with menopause, and that also is a risk factor. Two easy ones that we can avoid are constipation and diarrhea, because if your bowels are holding on to a lot of toxic waste, there's a lot of bacteria in there and it can seep out into your bladder.
And fluids are very, very important.
Very, yeah. So those are risk factors.
There's also diabetes.
Well, diabetes, of course,
right?
Yes. Diabetes, irritable bowel syndrome.
Right.
If you're immunosuppressed because you're like, if you have MS or any kind of immunosuppression disease, cancer, yes, lymphoma, anything like that,
right.
And you're taking meds to suppress your immunity, you are at risk for bacteria.
More susceptible,
right.
So,
and also, wait, don't forget, if you hold it too long, like all nurses do,
yeah.
you can definitely get a urinary tract infection.
Right, right.
So it's never good.
Never good to hold it.
No,
never.
It isn't.
Okay, good.
Also, if you've been taking too many antibiotics due to you had a bad knee, you had a bad hip, you had a bad elbow, some reason that you took antibiotics, you are also at risk for getting a urinary tract infection.
Right. Also, what is another risk factor that we sometimes talk about would be multiple sexual partners.
Yes.
Would also be a risk factor,
yeah.
And not just in the young and the elderly as well. So
exactly. So you want to be very careful of who you love.
Right. Also, if you have a hard time urinating, you get to the bathroom and then all of a sudden you can't go.
Right.
That's happened many, many times
yes.
to people that we take care of.
Yes.
So they'll present in all different ways.
Yeah,
so,
everyone is very specific to
right.
them. Yeah, it's a very personal.
So what do you think when, like I have a story that we have a recent patient that she was presenting with behavioral changes. We call them change in mental status when you go send them to the ER, but her behavioral changes were, she was very irritable, she was
she lashing out?
She was lashing out. She was very combative.
Mm-hmm. Not herself.
Not herself. Hard to calm down. Very angry.
Oh.
So my nurses had to, went out there to collect a urine and send it to the lab. So per doctor's order.
Right.
So.
As everyone knows that nurses can't diagnose or prescribe, but we can definitely go and help a patient send off their urine.
Right. We also can get the doctor's order if they're one of our patients.
Right.
We can go above and beyond for that.
Which is what we've done in the past, yes. Well, I'm sorry that she had a urinary tract infection.
I know, but she's on an antibiotic now, and within a day or two she started to feel much better and her mood changed.
So a day or two, you start to feel better. Do not think that you can stop. Absolutely, you must take. When you get diagnosed on a Monday, write it on your calendar how many days they ordered for you. If it's 7, put 7 X's on your calendar. Take every single one of those pills, because those pills are the ones that kill the bacteria. If you would like to live with bacteria in your body, throw 4 of them away. And then that bacteria will say, thank you, I'm gonna multiply and duplicate, and I'm gonna come back raging.
So it's very, very important. That message is to continue and take your complete dose of antibiotics. Even if you feel better.
Yes, especially if you feel better.
So let's talk about misconceptions. People think that they've had dinner the night before and their urine is smelling a different smell and they're unsure, do I have a UTI or is it the food that I've eaten? What are some of those foods, do you think?
Well,
I know what they are. But.
Yeah, so when you are lucky enough to be invited out to dinner, especially on the Cape or the South Shore, with your children, your grandchildren, your spouse, your loved ones, your best girlfriends, best guy friends, you're very lucky to be going to these amazing restaurants. Then they have their specials. Oh, it's salmon with a garlic twist on it, and Brussels sprouts is the special side dish for the day. And you wake up the next morning because you had the Brussels sprouts, you had garlic, you had onions, you had fish.
Right. All of those.
And you had asparagus wrapped in prosciutto as your appetizer, and so your urine will not be smelling nice in the morning.
But it usually is only for the day. But that can be the difference, because if you don't have any pain associated with it,
no fever,
no urinary frequency or anything like that, it could be just the dinner you had.
And that's fine. Just pay attention to your body. All of us do pay attention to our body. Sometimes you just have to smell and say, that does smell like asparagus, because everyone knows that. Well, a lot of people know that smell. Just pay attention to, do you have any other symptoms?
And it might not even be you yourself. It might be your daughter's coming to town and, gee, mom's different. What's going on with mom? She is angrier than normal and irritable, and I saw her yesterday and today is a whole different day. So if you are seeing your parent and that is happening, do your due diligence and find out, call the doctor, report that. Maybe it just might be as simple as getting a urine. And the best way to collect a urine to go to the lab is
a midstream catch. So what you want to do is you need to call your PCP, any provider. It can be your nurse practitioner or it can be your primary care doctor. They will order you a lab and they will send it to the area lab. For us down here, it's on Quest.
Or Cape Cod Hospital or Falmouth Hospital.
And you need to have a sterile cup, and you start to pee and then you catch it midstream.
Which isn't easy.
Which is not easy, and you don't want to touch the inside of the container or the cap. Put the cap on, squeeze it tight, put it on the counter, finish peeing. Bring that to the lab.
And if it was an elderly patient, we could also put them on a bedpan. And we would we could collect it that way.
Yes, you have to be very clean. Clean front to back, 3 times.
Right, and so while we're talking on that, now what? So we've collected the urine, the doctor says we have a UTI, you go on the antibiotics. How are we going to prevent another one?
Well, you need to take antibiotics to first clear this one up. So there are many ways to use the word biotic. Biotic will kill it. That's what it does. An antibiotic kills it. The doctor may also say, you've had one last year, now you're having this one, we're going to put you on a probiotic. That's every morning. It's a kind of a prophylactic way to reduce the amount of urinary tract infections. They also...
Good for your gut.
It's very good for your gut. If you have a healthy gut, you have a healthy bladder. They go hand in hand. But they also can put you on a medicine that will be bacteriostatic. So it makes insides of you not conducive for the bacteria to like, and so the bacteria doesn't stick to the wall of your bladder. And so those are 3 different things: the antibiotic, the probiotic, and then the bacteriostatic.
And they might also put you on some cranberry juice tablets.
Oh my gosh.
Concentrated tablets.
I love them. They're so good. We live in ocean spray country. This is cranberry juice country, and it's just very acidic, and bacteria doesn't like that. And when you're drinking cranberry juice, you're also drinking water. So the more you flush your bladder, the more you flush your kidneys, flush your bladder, the bacteria doesn't stand a chance.
Not only is water good for you for your everyday life, but it's also good for you to help prevent many, many different things.
Yes. They say in the literature that you shouldn't drink coffee or alcohol, but I'm not promoting that. I'm saying if you wake up and need a cup of coffee, by all means, please have a cup of coffee. But flush your system afterwards with your water.
Because coffee is dehydrating.
Dehydrating.
So is the alcohol.
We're trying to hydrate you. We're trying to remind you to be hydrated, not to make you feel bad. You already do feel bad. We want to make you feel better.
The other thing was on my cue cards is Greek yogurt. Yogurt's always good.
Yogurt is good, Greek yogurt, but you must look in the cases and get the non-flavored. Get very plain.
Unflavored Greek yogurt.
Because if it has too much sugar in it, that's going to feed the bacteria.
Sugar is not good as well. We meant to talk about that as well.
So if you have too many brownies and cakes and cookies, you're also feeding the bacteria. You should drink the cranberry juice, right, and then take the Greek yogurt. It's plain. Just eat it. It doesn't taste terrible.
No.
But if you have those live cultures in the Greek yogurt, Vermont Cabot is one of the best because it is so filled with very live cultures, and it's just plain Greek yogurt.
And that's an easy fix.
Yes.
That and the cranberry juice.
Yeah, and they're not expensive. Everyone knows groceries are expensive these days. Those two things are not expensive, and they help keep you healthy, so then you won't have the expense of being down and out.
Okay, so those are some of the things we can do. Let's talk about the hygiene to help prevent a urinary tract infection. For a woman, it is wiping
front to back.
Very important.
And less hot tubs, less dirty pools, dirty oceans, less soaking in your tub, more showers, and cleaning front to back.
So if your mom is being taken care of by a caregiver, always make sure that when they are changing their incontinence pads or whatever that is, that they are helping wipe from front to back. It's really important to.
And all our caregivers are trained. We have a skills lab that we teach them these 3 wipes, like you have to do front to back 3 times. And you may think it's difficult with an adult brief on when they're incontinent, but it's really not. You just take it off and then just really clean with warm water.
Incontinence is also a breeding ground for
which is why you have to change them so frequently.
As often as you see it, you should change it. Yes.
The other, when you're eating, we were talking about all the foods that cause your urine to be foul odor, but we also would like you to increase the fiber that you take, like eat foods that are fiber filled. You know, we don't want you to have the constipation. So we want you to have fiber-rich foods, you know. Well,
sometimes our elderly are worried about constipation, and they try to make the constipation go away, and then they get the diarrhea, and then vice versa. So always just err on the side of caution. Make sure you're in touch with your nurse practitioner, your primary care physician. If you have any of those behavioral changes, funny speech, irritableness, or anything like that, please make sure that you call your doctor. And it's as simple as getting a urine. If it's negative, it's negative. If it's positive, they're going to do a culture and a sensitivity to see which antibiotic may work best for you.
And so that sensitivity on the culture will tell the provider what drug works the best, what drug is sensitive to your bacteria.
Everybody is different.
Yes, and your bacteria needs this antibiotic, but my bacteria needed this one. And so a simple, uncomplicated urinary tract infection can be treated with that 7-day antibiotic. But if it's very complicated, we recently had a patient who the family just didn't want to send him to the hospital until it was too late. When she was so lethargic, she couldn't wake up. We couldn't wake her up. We finally called the ambulance, brought her to Cape Cod Hospital. They immediately diagnosed her with urosepsis. Terrible.
Don't let it go that far.
The bacteria had gone up to her kidneys and had pyelonephritis. So she needed the big gun antibiotics and intravenous, and she stayed in the hospital.
And sometimes that's 6 weeks and not just 7-day course.
And so that's very hard.
So the moral of the story of today's episode talking about urinary tract infection is know your signs and symptoms, know your risk factors, and do something, be proactive and do something about it if something were to happen.
And if you remember these 3 things, what, now what, so what? What? I have a UTI. So what? Now I need to get it diagnosed and treated. Now what? Now I'm going to think of all the things I can do to help myself. What, so what, now what?
So we hope that this was very helpful for you all today. It's been something that we've wanted to talk about because we have so many clients that we see that have a UTI, and it's a simple fix. So we wanted to bring that up to you for your attention today, and we are very glad that 2 sister nurses could bring this to you for for helping you.
Yeah.
And please, if you have any questions and you're unsure and you can't get in touch with your doctor, you could also call us at T.L.C. Private Home Care, and we will walk you through what to do.
Yes.
So thank you so much for joining us today, and we will see you next time for another exciting episode of T.L.C. Cares.
Yay!